Hi guys, it's Joey C. I am 5 days out from vertical sleeve gastrectomy surgery. Let me start by saying all you guys are crazy. I've watched all of you after post-op, and the amount of pain that I am going through was not displayed whatsoever. I have a fairly high pain tolerance. I've always thought anyway. And I've had multiple surgeries in the past and nothing's been quite like this. Still having a lot of pain today, cramping, not as much nausea. I do have a nausea patch that my doctor prescribed for me though, so that's helpful. And I'm taking fluids well. Last night though, I had clammy chills and severe lower abdominal pain. I almost went to the ER, but I kind of waited, and then I talked to my doctor's office this morning. I was embarrassed because I was thinking it was just gas, but I was also being a little paranoid thinking it may be appendicitis because it's the same feeling, and a lot of times gas pains will be confused with appendicitis. So I just took it easy and took some gas medicine, some extra strength Gas X, which will be your best friend for all of you pre-ops. And I'm doing much better now. I've been very mobile since getting out of the hospital. I haven't charged my Fitbit, so I don't know how many steps exactly that I'm taking, but I feel like I'm doing pretty good. My mom came out to visit me and take care of me. Say hi, Mom.
Hi.
And so we went and walked around Lowe's today a little bit and then did some yard work. That's a lie. I sat in a chair and watched my mom do yard work. But she loves me, so that's okay. And she likes doing yard work. So, but still on my clear diet, of course, for 2 weeks until I go back and see Dr. Khan. So I did drink an entire protein shake today, a Premier Protein, which has 30 grams in it. So I was able to keep that down, and everything's good on that, and just lots of water, pretty much. I really haven't been in the mood for broth or Jell-O at this point. I'm just kind of scared as to what may give me more gas pains or anything along those lines, so I want to just be very careful. But yeah, I just wanted to give you guys a quick update. I am home and out of the hospital. I got home Monday. I got home Monday. So I was there 3 nights, which was surprising to me. But my doctor said everything's good. One thing he did say is the amount of fat on my liver was remarkable. Now, you do your 2-week pre-op liquid diet to shrink and reduce some of that fat and also to shrink the size of your stomach. So even with my 2-week pre-op liquid diet, there was still an amazing amount of fat on my liver. He had to actually move things aside to find my stomach, is what he said. And he took a picture of my liver, and it's just disgusting. And my sister was at the hospital with me, and she was really worried. What do you do for that? What do you do for that? He said, well, she had surgery. That's what's going to do that. Losing weight will make that fat disappear off of your liver. It's just like losing fat on your belly. So, it's scary. I'm 26 years old, and I have that amount of fat, also have type 2 diabetes, and a number of other things. It's very scary to hear that. While I was in the hospital, my blood pressure was so elevated. I think it was just the pain and the anesthesia and white coat syndrome, as they say it, with all the doctors around it, can raise your blood pressure. But I'm talking like 190 over 120, and that is just scary for me. I've never had high blood pressure, ever, ever, ever. I am usually textbook blood pressure. So it was hard for me to hear that and to be dealing with that. I was actually on IV blood pressure medication when I was in the hospital. So I'm definitely just aware of that. I went by my work yesterday and had my blood pressure taken, and it was back down to normal, or normal for me. So that was good. I was very happy to hear that. And yeah, just making sure I'm up and moving and reducing chances of blood clots, because that is something that's very scary. You do not want to deal with blood clot issues. So just prevent that, and that's what I've been doing. And haven't really been hungry. If I am, I have a couple sips of my protein shake. My mom and husband are here, and so they're eating, and I'm not. Smells, I still love to smell food, but my stomach is like, oh, you don't want that. So that's nice, and I can actually listen to my stomach a little bit. So yeah, just wanted to give you a quick update. I'm going to do stats on Friday. I'm trying not to because I know there's still a lot of swelling and everything right now. So I'm going to do my weigh-in on Friday, and I will let you guys know what that comes back as. Keep your fingers crossed for me. And a shout out to VSG Rare Diamond 2. You had your surgery today, I believe, the 11th. So I just wish you the best, and I hope that everything went smoothly and you're not feeling as bad as I am. So good luck with anything, and thanks for watching. Talk to you guys later.